Did you know that there are some healthcare professional degrees that are now no longer considered professional under new federal rules? And most of the ones that have been eliminated are those that are dominated by women. So let's break this down because the ripple effect is bigger than most people realize. So under the One Big Beautiful Bill Act, the government has changed the way graduate student loans work. If your program is labeled a professional degree, you can borrow up to $50,000 a year and $200,000 total. But if it's not classified as professional, you're capped at $20,500 a year and $100,000 total, even if your degree costs far more than that. So now federal officials say that its intention was to standardize in which degree counts as professional to control federal spending. That means they focused on historically high-earning licensed fields like medicine, dentistry, pharmacy, law, optometry, veterinary medicine. But here's the concern. Many of the degrees that are excluded from the professional status are the backbones of our healthcare system and overwhelmingly staffed by women. Don't believe me? Here's just a few examples. Nursing, 90% women. Speech language pathology, 95% women. Social work, 80% women. Occupational therapy, more than 80% are women. And these are the exact fields that are now being pushed under the lower borrowing caps. So let's talk about what it actually means. Most of these degrees cost $80,000 to $150,000 to complete. So without access to federal loans, students are going to have to turn to private loans with higher interest. And most simply won't be able to enter these fields at all. So this just isn't a student problem. This is a healthcare system problem. We're already facing a projected 200 to 450,000 nurse shortage in the next 5 years. National shortages on speech language pathologists, OTs, PTs, and mental health care providers. Rural communities rely on nurse practitioners, physician associates, and allied health as one of their primary care workforce. So reducing access to these degrees doesn't save us anything. It's actually shrinking the pipeline, it's worsening burnout, it will increase wait times, and disproportionately harms women, first-gen students like myself, and low-income communities. And the people that are feeling the impact, it's not the policymakers, it's the patients and the frontline clinicians who are already stretched thin. Genuinely curious as to what you guys think, especially if you're in one of these professions. Please let me know what your thoughts are.